Hey Atlanta, welcome back. We're back in studio. We're really excited to continue our Trailblazers, Trendsetters, and Trendsetting series. It is Women's History Month, y'all, and Social Work Month. And today we are highlighting an amazing registered nurse, my friend, that I get to interview, Whitney O'Hearn. And I am really excited to have her. She is no stranger to IRA's platform. She was with us at the Black History Unapologetically Black event in Metro Atlanta at the YMCA. And she's back with us today in studio. So I get the privilege of talking to this trailblazer about her work in healthcare and how we could really change the game for moms, especially Black moms. So Whitney, thank you so much for being here tonight.
No problem. I'm so excited to be here.
Yes, you went through, first of all, you got lost coming, and then you were in all this traffic, and you still made it. So that means a lot to me. That's what a trailblazer is. Mm-hmm. A trailblazer goes, she or he overcomes all types of difficulties to make sure they make it. So Thank you for being here.
Thank you for having me.
Yes, ma'am. So I'm going to read Whitney's bio, which is on my phone. And then after that, we're going to jump right into our segment for today. So Whitney O'Hearn is a mom of two beautiful girls and has been a registered nurse for 6 years. She's actually licensed in 3 states. Those 3 states are?
Illinois, Georgia, and Florida.
Amazing. I love it. I love it. She has experience in a variety of subspecialties and healthcare. She's also a business owner seeking to bridge the gap, I love this, between patients and healthcare providers. She's also bridging the gap between workers and healthcare leaders. This is good, y'all. She is passionate about the elimination of bias and patient care services, where it often leads to patient harm. Through her efforts, she is working towards safe practices in healthcare and early detection of diseases and disorders. This is amazing. And she is also, her business that she will be launching and is working on right now is the United Health Equity Solution. So she is a trailblazer. She is a trendsetter. I've never heard anything like what you're doing. So I just want to give you your kudos for the work that you're doing.
I have to give kudos to God. It was definitely a God idea.
I love it.
I was in an event, and God gave it to me in my shower, and it was just like download after download. And he's just been continuously downloading, so I can't take credit for it.
I love it. I love it. And so tell us, like, what led you into the healthcare industry? What was it that sort of brought you into the industry? Was it a defining moment, or was it just something you always knew you wanted to do?
Yes. I always knew I wanted to work in healthcare. When I was a kid, I wanted to be a pediatrician.
Nice.
And I loved hospitals. I was so weird as a
Really?
child. I loved it. I loved the smell of hospitals, which sounds weird. It sounds really strange. But even my mom used to tell me when I was a kid that I love getting my blood drawn, which is weird. I wouldn't cry.
Isn't that something?
Yes. I was just like so fascinated with all the processes of healthcare. I would ask my doctor millions of questions. And so I always knew that it was something I had a passion for. When I was 17, I got pregnant, had my daughter as a teenager. But at that time, I met a registered nurse who worked in my school. And she was like, hey, I know you want to be a doctor, but look into nursing. Like, that's something that you can do. You could have somebody, pay for you to go back to school. Don't think that all hope is lost. So, keep pushing. And so once she told me that, it was like, okay, I'm focused on that goal and I'm going to make it happen.
Wow. So you were in high school and a teacher who was also a nurse. Is that correct?
She was our school nurse.
She was your school nurse. And that's very bizarre that a school nurse would be the one that would give you that, that inspiration. This is my first time hearing a school nurse inspired someone.
Yes.
But she inspired you. But what's really interesting to me is that you already had the passion for it as a kid.
Yes.
So, all the things that were leading up into the moment that you made that decision, essentially was inside of you. It was a part of who you were.
Yes, it was definitely. It was always there.
Yeah. So what's your journey been like? Like being a nurse, what are the disparities that you've seen throughout your career so far?
I would have to say my career has been up and down. I have worked in a variety of settings.
Right.
Like a lot of nurses, sometimes we try different things out to see what our niche is. But for me, the biggest disparities that I saw was in labor and delivery practices. And it really broke my heart. And it was like, it was so overwhelming that I was like, this is not my specialty. Because I felt like my voice couldn't be heard in that place. It was a lot of things that went on, and I felt like as someone who was concerned for my patients, I really couldn't speak up and make a difference in that space. Now, I came from a critical care background, and so I was used to advocating for my patients. And in critical care, a lot of times the nurses really drive a lot of the practices that happen with the patients. And in that space, a lot of times the doctors kind of depend on us. We work together. It's like a team effort.
Absolutely.
In labor and delivery, it did not feel like that. I was like, what is this? Like, you know, and so I would see issues. Now, this was in another state. This wasn't in Georgia, so I can't speak to Georgia labor and delivery practices. But I would see instances where patients were concerned about, you know, getting a C-section. And the doctors would kind of like, oh, well, you'll be fine. And oh, it's like, or they would be concerned about epidurals. Like, hey, I really don't want to do that. Well, don't you want to not have pain? But they're not really telling you that it's side effects to everything. Even if you get pain relief, from what I have researched and understood, your likelihood of having a C-section after epidural increases. It's not the same as you know, not having an epidural, which, you know, slows down the child's heart rate a lot of times and different things like that. Yeah, because, I mean, it's a drug. It's pain medicine. It has an effect on, you know, your heart rate, your respirations, and things like that. So those were some of the things that I thought was kind of odd. And I was like, that's not really right. And then a lot of times where people would kind of be talked into C-sections, like, hey, this is happening, so now we have to go to surgery. And of course, you know, if your plan is to have your child, you never want to think about going into surgery. Most people, you know, so that's like a traumatizing event. And it really opened my eyes. And I must say, for me, when I had my second daughter, I was, this was before I was a nurse, but because I had information, I felt empowered to speak up for myself and advocate for myself. So,
and that was with your second daughter. But your first daughter, it was, you didn't feel like you had that same empowerment or voice.
Not at all. I was 17 years old when I had my first daughter. So I felt like a lot of things were told to me. It wasn't like, hey, do you understand this?
Choices.
Are you okay with this? It was just like, hey, you need to have a C-section, come back at 8 o'clock at night, and this is what's going to be done. And it's like,
my goodness, that's scary.
Yeah, it's like,
that's really scary.
It's like,
and it's traumatizing. I'm sorry. Yes.
Yeah, it is. It was my first birth experience was like a traumatizing event, but I used it as a way to empower myself. When I had my next child, I was like, no, this won't happen. I will have a voice for myself. So I remember I went to one doctor and I was like, hey, I want to have a vaginal delivery. And he was like, no, we don't do that. It's a percentage. He said 2% to be exact. I'm like, you 2%. Probably have a higher...
That's a problem.
You have a higher percentage of dying walking across the street.
2%.
Yes.
Right.
And so he was like, well, no, it's very high risk for you to have vaginal delivery. I said, okay. So I went, researched which doctors are going to perform the procedure.
That's right.
I found my doctor and I told her from the beginning, hey, unless it's absolutely necessary, I don't want to have surgery. And when I tell you, she was a Black woman, and she walked and worked with me up until the time I pushed my child out. Like, she was, even as it was the process of pushing, she's like, are you sure? Like, you still want to? Yes, I do. And she listened to me, and I was able to advocate for myself. And it really felt rewarding to be able to say, okay, this is my body. I want this or I don't want this, you know? And a lot of times patients, they say those things, but
Right.
people ignore them or overlook them a lot of times when they try to speak up for themselves if they don't have I won't say the knowledge base.
Information, or is it?
I think what I find is people know something is wrong,
Right.
but they may not feel confident in what they know. They take like, oh, well, you're the authority. You know
Right.
more than me.
Right.
Instead of, no, you can't advocate for yourself. Even if you don't have the verbiage
Right.
to speak up to say, hey, I know these medical terms. This doesn't feel right to me.
Right.
You know?
Right. It's interesting because I'm listening to you. I'm thinking about a story. My own sister who, she had a C-section, I think with all three of her kids. And I think her last child, actually four for kids, sorry. Her last child that she had, they didn't tell her anything, but they just did an emergency C-section. And she says she felt like she was going to die, like she was on her deathbed. And it was so traumatizing for her. And, you know, to this day, she hasn't really gotten through that trauma. Mm-hmm. But I'm thinking about how even the environment a lot of times and labor and delivery is not conducive to even help women process that experience. Mm-mm. Like after they've gone through the trauma, is there any type of therapy to help rehabilitate them? Not just physically, but even emotionally.
Right. I don't know of any. It's not even really spoken about. I feel like it's just like, hey, well, you brought your child into this world. You're safe. Your child is safe. I think that's kind of the consensus of the matter. Mm-hmm. But people, I don't think providers realize it's almost like you're taking a person's rights away from them, like their freedom. I mean, this is my body. I can't speak up for what I believe should be done to me, then, you know, I don't.
That's a problem. Mm-hmm. And I think that's why your voice is so important and the work that you're doing is important. The fact that you not only recognize the disparities, but that you have the conviction to do something about it is huge. Because I'm sure there are a lot of nurses that may see it, but may just become numb to it because they're in a system that has been designed to essentially overwrite people's rights. So the fact that you see it, but you're also like, I want to do something to change the system is really important. Yes. So talking about that part, what does it look like for you to change the system, to change healthcare and to make sure patients are dealt with equitable and that they have a choice and a decision and those decisions are given to them? What would it look like for you with your company, United Health Equity Solutions?
I think it starts with education.
Yeah.
A lot of times, like I was listening to your one guest that you did a fireside chat with the professor, the doctor,
from Yale University.
And like she was saying, it's even the language breakdown. You know, like how are you speaking to your patients as a doctor? Like, do they understand what you are saying? A lot of times doctors come in and I'll be there at the bedside with them and they're using like all these medical terms and they're like, okay, sign this paper. It's like, this person doesn't understand what you just said. Right. Like even the use of like layman's terms, they, you know, it's those things. Right. And so I think it starts with education of medical doctors, number one. I think it starts with education of nurses also because we are the advocates for our patient. We are the last stop that a patient has. You know, if something goes wrong, it's really on us a lot of the times because we're the ones giving medications. We're the ones, you know, at the bedside with them throughout the entire experience. So I think we have to educate doctors on how to speak to patients in a real way, like not just, hey, across the board, I talk to every patient like this. Like every person is different. Right. And then I also think that we have to educate them on their own biases that they may have, like those things that they may not even realize they have when they're overlooking patients or, hey, I'm telling you, I have abdominal pain, and you're saying, oh, well, just take some medicine, you're fine, instead of investigating further. And then now this person comes to the hospital multiple times for the same thing, and they're labeled as a frequent flyer, but
What's that for people that
Okay.
are not in the healthcare system?
So
we need to know what that is.
So that's like a terminology we give to patients who return to the hospital multiple times for like the same symptomology.
Wow.
So
Wow.
yeah, they give them labels for those type of things.
Wow.
And then it may come years later sometimes where now, oh, this person really did have X, Y, and Z wrong with them. But how many doctors ignored the symptoms and just wrote it off?
What happens when that happens? I had, it's so infuriating because people die from those type of mistakes.
Absolutely.
And from not listening to patients when they're coming to them, telling them I'm having this pain, and they're not performing the proper test or whatever the procedures are. What is happening? Where is the gap? What's going on in healthcare? If you could identify it.
I think one of the gaps is the doctors not understanding the patients that they're serving. So I think I'm not going to say just because a Black doctor sees you that they won't overlook it, because sometimes, in a lot of cases, that can be the case.
Right.
I think some doctors can be, overworked, stressed, tired, and it's like, hey, I just want to get through this day and get through this job. Or other times, like you deal with residents, they have been taught a by the book approach instead of like, hey, just because the book says 1, 2, and 3 add up to 4, that doesn't mean that that's the case with every patient, And so I think a lot of times we can not really listen to what patients are saying.
Right.
I think it starts with that, like, hey, do you listen to your patients? Are you really hearing what they're telling you?
Right.
And then what are you doing after that? Like, are you really doing the tests necessary to rule things out that are going on with your patients? Okay, if you can't rule it out in the emergency room, then are you making it known to the patient that they have to follow up to get this thing addressed? Because a lot of times people do utilize the emergency room as like a primary care center, which is not correct. We should be having primary care providers. One thing I want to stress the importance of that. I will caveat to that.
That's very important.
It's real. I want people to know the importance of having a primary care doctor. That person, at least they will know you. They know your background. They can advocate for you once they know, like, hey, this is normal for her. You're not too young to have one, because you never know when something can happen to you. I believe it's vitally important for you to have a primary care doctor. So that's another place where I've seen discrepancies. My stepfather had an issue. He had never been sick his entire life.
Wow.
He went to the hospital. He was really weak, throwing up. Turns out he had a bowel blockage.
Wow.
So he needed a bowel resection.
Wow.
And they did it.
Did he have a primary care doctor?
No, he didn't.
Yeah.
So it was that, and that caused like a whirlwind of issues with him because he didn't have one. So when we went to the hospital, they're marching him off to surgery, and it's like, hey, he's on his way to surgery. And my mom happened to go back, and see him. And she was like, how will you take someone to surgery and not notify their family? Well, he's alert, he's oriented, he can speak for himself. But this is the thing. My stepdad was from Alabama. He had never interacted with doctors before. So he didn't have full comprehension of what was going on.
He didn't even know what was happening. He was just being rolled to be cut open. That's really scary.
Just because they can read and write and you think they understand, that doesn't mean they understand what you're telling them. So later on, he had all these issues. And I thank God that I was a nurse at the time, because I really had to advocate for him almost as a doctor. I had to speak with different specialists because he could have died.
Wow. That's scary. It's really scary. It reminds me of a probably not as similar story of a friend of mine whose father was having, I don't know if he was having a heart attack, but the way that they were dealing with him or handling him was in a way that was was enhancing his anxiety, and he almost stopped breathing. And she had to direct them on what to do, how to handle her father in order to make sure he lived. Thankfully, he did.
Yes.
But it's a matter of life or death, and it's really scary that that these things are happening every day in healthcare. I'm thinking of this term, but it may be so foreign or not even accurate, but like a healthcare advocate.
Amen.
Someone that
That's
can
what it
just
is.
advocate for you, that stands in a gap, because there seems to be so much disparities between the doctor, the nurse, and the patient. It's almost like there needs to be a way to bring them together, but also to help the patient to be able to advocate better for what they need.
And that's actually funny that you say that, because when God gave me this idea in my shower, that was the word that he gave me.
Wow.
Literally, yes. Like healthcare advocate is what he gave me as the word.
Wow.
So I believe that is what I'm called to do, to advocate for patients. Like I have a passion for it, but I also have a passion for us as like nurses and providers, because I don't think the entire issue is the doctors or the nurses. I believe it starts with the education that they're receiving and the education on, like your doctor was saying, bedside manner and those things that you do when you interact with your patient. So I think it's a variety of things that need to be addressed in order to, stop or eradicate this issue.
Yes. I'm thinking about two things that's important, that's interconnected with this. One is lack of access to health care. And I think a lot of people utilize emergency rooms like primary care doctors because they don't have access to health care. And there's so many reasons why. It may be financial, it may be lack of access because their jobs don't provide it, or it might just be because they are not allowed to be covered because they're immigrants, right? So there's so many things that we need to address externally to make sure that we're ensuring that we have preventive measures. That's one thing I'm thinking about. I'm also thinking about this idea, may seem so foreign, but how do we bring this into our schools? So our education system, because it is all about education. And if we can teach our kids this, and I think we typically have like a health education class, and I don't know how much of it is relevant to the information they need in the actual doctor. Like, are they providing relevant, up-to-date information in that curriculum in schools to high schoolers? Because I think if they know their rights in school, when they go to their doctors, they're better able to advocate for themselves.
Absolutely. I definitely think that is a thing. Even like when you had your event at the YMCA, I was even, the group of girls that I was speaking to, they were 9 and 10 years old. And I told them, I say, even if you, at your age, if you don't feel like what's happening to you is correct, or you feel weary about it, you have a right to speak up and tell your parent, and you can tell your parent, hey, mom, you don't have to take what they say as the answer. You can still speak up. And if they don't want to listen to us, you can go to someone else who will listen to us.
That's so powerful.
Yes, and I think it does start there. I think it starts with the education we receive, like at home or at school, like just the everyday person who doesn't have healthcare knowledge, what they understand about the healthcare process, because it's something that all of us at one point in our lives interact with for the most part.
That's so powerful. And I love that you told the 9 and 10-year-olds that, because it's so true. If you don't tell them, who will? Because a lot of times we're just given information and we're told this is what you have to do. I think we've seen that even during COVID. We did a whole panel on COVID-19 hesitancy, some people that were hesitant because there was such a mistrust in the medical field, right? Because for many, many generations, Black folks and people of color were experimented on. And so there was such a mistrust between medical professionals and people. And they didn't trust a lot of the information that was just thrown at them and shoved at them and told, you got to do this, you have to do this, without giving them a chance to make an informed decision. So there's such a gap. There's so much work that needs to be done, but you're doing the work not just on your job, but through your organization.
Yes, I want to, like I said, bridge the gap between patients and their healthcare providers, where it's a trust, and they can honestly feel good about going to their healthcare provider. Like, this person has my best interest.
Right.
And it's not like I'm just a dollar sign to them, or, you know, they have family issues going on. So my symptoms are just like a long list of things that they, you know, have on their list of things to do. But I can trust that when I go to this place, I can be safe.
Feel safe. Yeah.
And I will say, like, I was watching TV and I see Oprah Winfrey did a documentary, and I just saw like the headlines, but she said you can literally track the age span of somebody or the lifespan of someone based upon where they live in their zip code. And it's not because of like, you know, food disparities. That's one issue. But you can literally track it based upon the access they have to healthcare.
That's right.
Yes.
That's right. And that's so powerful. Like, if you don't have access to health care, your lifespan decreases. Like, I mean, if it's not a matter of life or death, to me, it sounds like a pandemic in itself. And we've seen that even throughout the pandemic, so many people dying because of underlying conditions because they didn't have access to that. So it's a matter of life or death. We need this type of education. We need this type of just advocacy in our health system. We need it in our schools. We need government officials to be also organized on this. We need to be serious about this because this is a major issue in our communities, especially our communities of color.
Absolutely. I would definitely say it is an issue that needs to go even to the policy level, where it's something that needs to be instituted into every facet of healthcare, because it's something like, if you look up the statistics on medical error deaths, it's alarming. Like, no one should die because of medical errors, you know? And those are things that are preventable. Medical errors are preventable actions. But a lot of times, healthcare workers, we work too much. We don't get paid enough. Even the doctors, they are overworked. Some of them are, you know, these residents are on 3-day stretches where they've been at the hospital. And and it's really alarming how they set up, you know, the institutions of medical practices and how they train them and teach them. A lot of things have to change. And I think, like I said, it even has to be at that level where doctors, hey, you have this class on this, like those things, like a class maybe on bias, and a class on like equity, and then also a class on just speaking as a doctor, because some of them are like so intelligent, like some of them are brilliant. And when you're that person and you are from maybe middle America and you've never met someone that looks like me, how would you know how to interact with me? How would you know how to address my needs? You've never met anyone like me before. So those things need to be addressed, I believe, in medical institutions, even in nursing schools. I would say this. When I was in nursing school, it was so alarming. We took a class, I want to say, it was something on like healthcare bias or something like that. And they gave us a piece of paper and they're like, hey, we're going to study this. And these are the things that each like ethnicity does or does not do. And these are like the nursing implications for it. And it was the most racist piece of paper I've ever seen in my life.
That's insane.
It was. And I was like,
scary.
This is what you're using to train people on how to recognize needs of patients.
This was in a school, like an accredited university.
My school that I graduated from.
Really
and a
scary.
lot of them, if you go on a lot of websites where a lot of Black nurses are, they will tell you when they got their training on it, it was racist. Because even for like Black people, African Americans, what they put under a category, you know, they're kind of lax about time, so they may not make it to appointments on time. And
oh my goodness.
It was so racist. It was just like
so racist. And we got so much work to do. Because this here, I mean, I'm listening and I'm thinking about, I always think about things from a policy and a systemic level, and then I think about it culturally. But there's so much work to be done. And I think it was Dr. Oh my goodness, I don't remember his name. Dr. Lou Hart from Yale University. He talks about medical racism. He's very vocal on this. Look him up. Those that are listening to look up Dr. Lou Hart. He's really trailblazing this as you are, and he talks about the medical racialized algorithms that exist in healthcare.
Wow.
There are racialized algorithms and that will predetermine a type of care that they give a Black person. And we don't have time to go into it, maybe another segment. But when I tell you, when I heard this information for the first time, which was like 2 years ago, I was so astounded. I had to bring him on to talk about this on a citywide level in New York City. And we were astounded to hear these statistics. So there's so much work to be done here on this issue. I am grateful for people like you, Whitney, that are trailblazing this field, because I know it's not easy, but you are doing it. You are sticking it in there, and you're passionate about it. You have the lived experience, but you have the knowledge, you have the heart, you have the posture for it. So I'm grateful that you're doing this.
Thank you.
Our healthcare system will be better, I believe, with people like you. It takes one. Sometimes it just takes one to start the trend, to set the trend.
Absolutely. I agree. I agree. And it's like you said before, it's so many nurses that feel the weight of this thing. They're like, hey, this wasn't kind of right, or I didn't feel like maybe we shouldn't have been doing this, but I didn't want to speak up. Or if I did speak up, I was told like, hey, no, we're going to do it anyway. So just being that voice and like you said, at a policy level, making it so that this transparency begins where people's lives will be saved, where people will get early detection of diseases and not when they're in stage 4 cancer on their deathbed is when they find out they have, certain illnesses. So, I think it's definitely needed. Policy changes have to be made. It has to be made from the top in our school systems that are training our healthcare professionals. It has to be done.
Absolutely. Well, I am so grateful for the information. We are closing our segment here, but this was so insightful. There's so much that I'm thinking about on ways that even I-Raise girls and boys can support the work out here in terms of healthcare. We just received a grant, some health-related grant. I don't know exactly what the initiative is about. I got to check with my staff, but this is so important. It's a matter of life or death. We need to address this on a systemic level, policy on a micro level, in hospitals and schools, holistically working together collectively as a community. Whitney, I appreciate you.
Thank you.
Thank you so much. You are not a stranger. You're a family now, so we'll be inviting you back on soon.
Thank you for having me.
Thank you so much for being with us. Thank you.
Thank you.
And thank you all so much for listening and for tuning in and for watching. This is our Trailblazers, Trendsetters, and Trendsetting series. And we have a trendsetter here. Whitney, how can people reach you if they need to get in contact with you?
Well, I have my website being set up.
Awesome.
So I am going to get back to you on that one.
Yes, ma'am.
But I'm setting up my website and all my information. I'm getting that together.
Awesome.
So for now, I am on Instagram, I would say would be the best place to reach me.
Awesome.
It's Becoming Whitney at Outlook.com. Is that how you say it?
Becoming Whitney at Outlook.com. We'll make sure we get the information out to the listeners.
It is Becoming Whitney on Instagram.
Awesome.
Listen, I just got on Instagram
That's okay. We're setting the trend for our generation too. But you can reach her at Becoming Whitney on Instagram. But we'll make sure we put the links so that you can reach out to her should you need to talk to her. We appreciate you all so much. Thank you to our amazing listeners. Thank you so much for being with us, for sticking with us, for sharing this content. Don't forget to subscribe to our podcast or whatever platform you're listening to. It's Women History Month. It's Social Work Month. We appreciate you, all the women out there and all the social workers. We'll be back next week. Stay tuned. Thank you all.